Okay, so I'm probably going to take a little flack for this one today, but I'm going to go ahead and put this out here. I've got a burr up my ass about the increasing tendency to identify addiction as a symptom of something else. The ASAM definition of addiction, the first sentence, it begins with, addiction is a primary chronic disease of brain reward. And so the word primary means that it's not a symptom of something else. And so if we cut straight to the chase here, the most common example of this is we hear this a lot these days. Addiction is a symptom of trauma. Everybody, oh yes, addiction is a symptom of trauma. And it's just important to recognize really what this comes down to, in my view, is one little difference. Of course, it's going to be a natural tendency for someone who suffers from trauma to want to use substances for relief. Using substances is going to provide a benefit for the person who suffers from trauma. And so you might, I wouldn't call it a symptom, but using drugs is a result of trauma or a symptom of trauma. But what's important to understand is that addiction occurs as a result of the repeated substance use, the interaction, the impact it has on the brain in that reward center. It stores memories of the repeated pleasurable event, and it rewires. That's the disease part of what addiction is. And here's the key, and the thing that I'm aware of causes problems for people, is that we have a tendency to conflate the two and think that resolving the trauma fixes the addiction. And the thing is, resolving the trauma does not automatically cause the brain to revert to its normal, healthy, functioning state. Rather, if a substance use disorder develops, and that's where that word chronic comes in, doesn't mean that it automatically is fixed by healing the trauma. What you have is a healed person with a substance use disorder, and the substance use disorder still needs to be addressed and managed. But again, my concern about this is, and it's only from direct experience with clients I work with. I've worked with a number of clients over the past couple years who are focused on, they're watching YouTube videos from professionals talking about heal your trauma, and they're using that as an excuse to avoid their clear addiction that has developed. And I'll give one example in specific. I was working with a lady a year ago, and she was losing her children. She'd been in prison and was on parole, and she couldn't pass a clean drug test because she used to use heavier drugs, and now she only smoked pot. But because she couldn't pass a clean drug test, she was on the verge of losing her children. And she was convinced she wanted nothing to do with addressing her substance use issue, even in the face of losing her children. She would continue to smoke pot. She got arrested smoking pot in her car or something like that. And she was watching videos on YouTube, learning that she needs to focus on her trauma. And again, I'll say this is going to sound very crass. I could say, I'm not that concerned about her for her loss of her child. She's free to do what she wants to do as far as she can educate herself about the nature of her condition, that she's developed a substance use disorder over the course of years of substance use. And she's free to educate herself about that and make choices about what she wants to do to manage that. I will say who I have concern for is the innocent child that's being damaged as a result of the mother's substance use disorder. And again, there was nothing I could do for her because she's focused on the YouTube videos that she's watching that she's conflating. I'll bet you if I talk to the professionals who are putting those videos out, they'd say that's not what we're saying, but I'm here to report that's what a number of clients that I've worked with, how they interpret it. Because again, when you're working with someone with a substance use disorder, there's a built-in mechanism that wants to protect that substance use disorder. I call it the party voices. They are engaging the brain, and they're saying we want to protect this and stay in this state. And so they're wanting to focus on, oh, there we go. I'm going to focus on my trauma, and I don't have to take responsibility for the substance use disorder. So again, I'm sure that trauma specialists, I'm not a trauma specialist. I concede and I defer to the trauma specialist. I'm just telling my experience is that when there is trauma, and I happen to believe, yes, we all have trauma in some form or fashion, and I wholeheartedly recognize the tendency to want to use substances to medicate or gain relief from that. It's just important. So to sum this up, to say that I think there's one additional step. Rather than saying addiction is a symptom of trauma or any other condition, it's one additional step in there. Almost the using drugs is a symptom. I'm not sure that's the exact right term for it, but a result of trauma. But it's the using of the drugs. Addiction is a symptom of the using of the drugs. And the reason that that's important to recognize is because it helps us see, no, the brain has changed as a result of the substance use, and that's what we have to address and be responsible about is where is my brain functioning at this time? Am I susceptible to the other things that ASAM definition identifies in the definition of addiction? It's a chronic condition. It's a progressive condition. And guess what? The only thing that makes it progress is continuing to use the substances. And then another term is it results in loss of control. We go ahead and use because that rewiring of the reward circuitry goes ahead and tells us to do that, even though we know that we shouldn't. And then we have consequences, but it's not uncommon for someone with a substance use disorder to remain in denial. And as I said, I look at the innocent child who is losing his mother because she can't see what's going on with her substance use disorder while she's convinced that she just needs to focus on the trauma. So I got that out. I only share this because, again, we're not so far apart. I just think that's important to recognize the implications for if a person is diagnosed with substance use disorder. Hope you found that helpful. I'm open to hearing the rebuttals because I know that there's people out there that don't believe the way that I'm suggesting this, and we can have discussion about it. I'm just trying to advocate for the people that I do see who are suffering from substance use disorder. If you got something out of this, feel free to hit the like button on this. Some of you might not want to do that, but also, I'd be happy for you to subscribe to my channel. I'm putting content out all the time. Thanks a lot for listening.